When I first got housing on Treasure Island, I felt excited. Under the island, if you dig in it, you might see gold and also metals. Nobody's ever found it.
I've been through, I think, 5 or 7 shelters, and then we came to Treasure Island.
I only had one friend in San Francisco, and now I have like 7 friends here.
I think radiation lives nearby. Behind the fences, there are rocks from outer space. If somebody touches it, they might get it all over their body and might die.
They said there is treasure on Treasure Island. The workers are hiding it. They're probably protecting it from people like us. People haven't found the treasure because they're scared of the radiation underground.
The radiation spreads out everywhere. It goes through different cracks.
Lots of treasure. Got it. Break this good too.
Me and my brother like to go exploring.
Like for rocks and all that.
Is the mark there? If it is.
Mark. There's a M, kind of like an M right here.
Come on. Come on. Hurry up, slowpoke.
Radiation moves like the waves in the ocean.
Whoa.
It looks green and has purple dots. The radiation is making people sick. It makes my body feel sad. when I grow up, I'm gonna live in the city. I don't think it's safe in Treasure Island.
Hi folks, my name is Suepierre and I am the environmental scientist at the Exploratorium. Thank you so much for joining us for tonight's After Dark program, which covers a topic that's so important to me, but should be really important to everyone. That is environmental justice. Environmental justice works at the intersection of social justice, environmental science, environmentalism, and anti-racism. And really is an issue that combines all of the major issues that we face in society today, including climate change and ongoing racist systems that oppress people and disproportionately impact communities of color in this country. The people that you're going to hear from tonight are themselves people of color who have used the tools of science, including observation and inquiry and data collection, to advocate for their communities and to make sure that the unequal treatment that they experience does not go overlooked or normalized. As you hear from them, please think about the ways that noticing, inquiring, and looking at data are their own type of advocacy and activism. And that when marginalized communities actually have the opportunity to do those things, to ask questions and to use the tools that scientists use all the time, those communities can really change their own circumstances. And that work is incremental, but it is ongoing. And I want to also just take a moment to honor the people that you'll hear from tonight. These are folks who have had their own careers, both within and outside of environmental justice, and have dedicated their lives to this work, and so have tirelessly and at times, I imagine, thanklessly, done the work of noticing, organizing people, and raising their voices on behalf of communities of color. I think that this is the core of environmental justice. Loving your community and asking questions and noticing patterns in the world around us, and finally, empowering yourself and your community to use data as a form of activism. So with that, I will turn it over to Kate O'Donnell and our amazing panelists. Thank you.
Hi, thank you for joining us this evening. My name is Kate O'Donnell. My pronouns are she, her, hers, and I'm a senior project specialist with the environment team at the Exploratorium. Before I introduce our panelists, I want to recognize that we are all on Indigenous land. And while we're coming to you from our various homes this evening, the Exploratorium sits on Ramaytush Ohlone land, and we thank the Ramaytush Ohlone people for their past and present stewardship of that land. Our work in the Exploratorium Environment Group centers on understanding our local landscape through the perspectives of scientists, artists, community members, policymakers, and other stakeholders. When the museum is open, we are centered in the Bay Observatory Gallery, and we're really excited to be collaborating with public programs for this virtual program tonight. In this program, we're going to be exploring our connection with land and place through the lens of environmental justice and environmental racism. One of the top determining factors for our health and lifespans is where we live. Proximities to air pollutants, landfills, toxic waste zones, water contamination are all major driving factors in our health. And in each case, these environmental hazards disproportionately affect Black communities, Indigenous communities, and communities of color. Our guests tonight are here to help us understand this and what we can do about it. So it is with great pleasure that I introduce Ms. Margaret Gordon and Phoenix ARMENTA of the West Oakland Environmental Indicators Project, and Dr. TERESA Munoz of Kaiser Permanente and Climate Health Now. Ms. Margaret Gordon is the co-founder and co-director of the West Oakland Environmental Indicators Project and a legend in the environmental justice movement. For decades, she has tirelessly devoted herself to improving the quality of life for the residents of West Oakland. Her numerous collaborative efforts have resulted in very tangible improvements that have led to safer jobs, schools, and homes. She's held roles on numerous local and state advisory boards, including being the first West Oakland resident to become a Port of Oakland commissioner. Her work has garnered numerous awards, including from the U.S. Environmental Protection Agency and President Barack Obama, and I could go on about her work for far longer than we have time for. Ms. Margaret, it is such an honor to have you here with us.
Thank you very much.
I'm also thrilled to have with us Dr. TERESA Munoz. Dr. Munoz works in Kaiser Permanente's Women's Health Department in Richmond, California, where she serves working class women of all ethnic backgrounds. Her goal is to empower her patients to take their health and the health of their families into their own hands and give them the tools to succeed. She was raised in a small town outside Mexico City before emigrating to the US as a child. And throughout her life, she's seen the effect of diabetes, high blood pressure, heart disease, and other preventable health conditions ravage her community. She became a doctor to help alleviate suffering. Understanding that healthcare must go beyond the walls of her office, she also participates and supports programs in the Richmond community, including the UJIMA Family Recovery Services, Mindful Life Project, and YES Nature to Neighborhoods. She's also a member of Climate Health Now, a group of doctors and health professionals in California taking on the climate crisis to protect their patients and the people and places we love. Welcome, Dr. Munoz.
Thank you very much.
And finally, we're very excited to have on our panel environmental justice educator and activist, Phoenix ARMENTA. Phoenix is the community air liaison at the West Oakland Environmental Indicators Project, and they've worked on environmental, racial, and social justice campaigns around the world, including anti-nuclear organizing in Japan and India, homeless advocating in San Francisco, and multiple civic engagement and political campaigns throughout the Bay Area. Through their work on political campaigns, they've helped to get multiple progressive people of color into political office. They're co-founder of the New Leaders Council Oakland, a professional leadership development organization, the Get Free Project, a civic engagement project that puts everyday people into the political process, and Woke Witch, an earth-based spirituality lifestyle brand. They also work as a teacher with a Mycelium Youth Network. Welcome, Phoenix. So as I mentioned in the beginning, the zip code we live in is one of the top determining factors for our lifespan. And when we talk about the zip code areas that have shorter life expectancies, we're usually talking about communities where Black, Indigenous, and people of color live. So I'd like to start out with you, Dr. Munoz. Can you help us understand why where we live is such a determining factor in our health and how disproportionate the effects of environmental degradation are on communities of color?
Yeah, I think, that it really has a kind of a complex answer, but I also think that it's important to ask, why did people end up living where they're living? And the answer really is racial and economic discrimination. And there's been a long history of that in our country and throughout the world, unfortunately. So people of color have been pushed out to areas that are less desirable. And there have been unfair lending policies that have kept people, primarily Blacks and people of color, from buying their own homes. At the same time, we've had a lot of investment in primarily white suburban neighborhoods. And so this created a gap right between neighborhoods of people of color and white neighborhoods. And poverty has really concentrated in our neighborhoods of color. And what this did is it had this ripple effect where we had businesses leaving and then also schools declining. And so our zip code really represents more than just the house we live in, right? It represents our opportunities, our exposures, our access to services or lack thereof. And what we're getting, what really we need to start talking about is what we call social determinants of health. And our current medical model fails to take them into account. But we know that social determinants of health make up the bulk of our well-being. So a healthy community needs access to things such as clean air, clean water, safe and affordable housing, green spaces. And we know that poor neighborhoods, unfortunately, don't have access to many, if not all of these factors. And so take air pollution, for example. So the neighborhoods that are in close proximity to the sources of air pollution, like refineries and freeways and industrial complexes, typically tend to be poor neighborhoods, right? And so the people who live in these neighborhoods have been chronically exposed, maybe since childhood, to unhealthy air. And so there have been studies, and we know that chronic exposure to unhealthy air is associated with heart attacks, strokes, pulmonary dysfunction, hospitalizations, and all of these really lead to a shorter life expectancy. So we also know that poor neighborhoods are food deserts, meaning that they don't have access to fresh fruits and vegetables. And again, we have a large body of evidence that links poor nutrition to heart disease, stroke, diabetes, cancer. We also know that your food choices can affect your psychological well-being, affecting illnesses such as anxiety and depression. So you can very easily see that someone living in a poor neighborhood in Richmond has less access to this healthy type of lifestyle than someone living in the Berkeley Hills, for example. What may not be so evident, though, is that poverty exposes people to stress. So the stress of being worried about whether or not you're going to be able to pay your rent, or the stress of being fearful of sending your child to an unsafe school, or even just the inability to get a full night's sleep because of noise pollution. All of this changes the hormonal structure within your body, leading to increased levels of stress hormones, primarily cortisol. And again, large body of data showing that increased stress has adverse health effects on people. And so what happens is people who are under chronic stress are kind of stuck in this like fight or flight mode, right? And when you are in this chronic reactive mode, your ability to respond to physical, psychological, and emotional disturbances is altered. And so Dr. Anthony Eiton of the California Endowment has said that people of low-income people are physiologically different than high-income people, not because they were born that way, but because our policies, or lack thereof, have made them that way, right? And so the other point that I wanted to make is that poor people living in poor neighborhoods not only lack access to healthy alternatives, the unhealthy ones are often they're often addictive, and we have corporations that spend millions of dollars on advertisement and on research to understand human psychology, and they push their products onto into our homes. And so I think that we're asking people to engage in a battle that is unfair. They don't have the tools to win, and they're starting off as a disadvantage.
Thank you, Dr. Munoz, for walking us through that. I really encourage people who are watching to look at some of the links in the comments and chat for additional resources about environmental justice. There are so many different aspects about it that we don't have time, unfortunately, tonight to cover, but it's really important to learn about these different facets. Tonight, we're going to be focusing, though, mainly on air quality. And like you were saying, Dr. Munoz, this issue is so prevalent in a number of different places in the Bay Area, in Richmond with Chevron's refineries, in West Oakland, where we're going to be focusing sort of the rest of our conversation today on, with its proximity to multiple freeways as well as the Port of Oakland. And this proximity of communities of color to major pollutants isn't accidental, right? The number one determining factor for whether you live near toxic waste is your race. And this stems from very deliberate racist policy. So, Ms. Margaret, I was wondering if you'd mind sharing sort of a brief history of redlining and how that affected West Oakland.
First of all, as West Oakland has been developed from the Spaniards claiming the land and people coming from back east to west and the gold rush and all those different things, West Oakland has always been a place of people being engaged, so first of all. Even with the redlining as a place to look at, as a place that was developed after World War II and the Korean War, where there was not a lot of money around for infrastructure or for infrastructure plans, and also the surge of developing freeways and the surge to develop public transit became a place for West Oakland, and also having land as close to water, a body of water, and a bridge made it a target for an industry to move goods. So it comes from a totally a different type of industrial use that had not been developed, had not been developed, but was being developed in order to make the residents be under a pressure of not being full citizens with the same infrastructure that other parts of the community had, other parts of Oakland had, and at the same time fighting these industrial businesses that was coming in that did harm to their health. But West Oakland has always had a core group of folks that was involved in advocacy. I want people to really understand there was always been a core group of somebody doing advocacy. From my knowledge base, either through the church or the social clubs that they had, but there were always a form of advocacy in West Oakland. And West Oakland Environmental Indicators has picked up that banner and continuously educating through research and data to give that tool and a resource to people about advocating for themselves to have no harm done to them, as the same as other parts of the city of Oakland.
Thank you. Yeah, I am very much looking forward to talking more about your work and the West Oakland Environmental Indicators Project. Quickly before we get there, Phoenix, I wanted to ask you a little bit about some of the need for that work. What are some of the ways that the racist past that got us to where we are today, the racist present, affects the West Oakland community today?
Yeah, I'd like to kind of tell a little story from the data that we have here. So if you can see this right here, this is a map of Oakland. And this is a redlining map of Oakland. So these are originally the communities in red were the communities where you could not buy your house historically. And if you go and match it over with a couple of other maps, so the Department of Toxic Substance has a mapping tool called EnviroStore. And if you look at a map of Oakland with EnviroStore, you can see all the toxic sites lining up right along where those red sites were. And then you have one more tool called Cal EnviroScreen. that you can look up, and this shows the environmental burden of those communities. So you see again, the orange and the red are the high pollution areas. This orange right here is West Oakland. And you can see just a mile away is the city of Piedmont. And that's a city that is mostly white, mostly affluential. They have actually made themselves their own city. They used to be a part of Oakland, but they made themselves their own city so that their taxes wouldn't go to helping Oaklanders. And this city you can see is completely in green, which means it is one of the least environmentally burdened communities in all of California, sitting about a mile away from the most environmentally burdened communities. So if you look at the data, you can see it's very clear that this has been a years-long systemic approach to environmental degradation in Black and brown communities. And we have not gotten here unintentionally.
Yeah, thank you for that. And just to sort of recap, that redlining and being was really about, where, like you said, Black and brown people of color were able to buy a house, to live, et cetera. And as you said, very, very intentionally deliberate in the way that this has evolved. So, Ms. Margaret, you were speaking about how West Oakland has had this amazing history of people coming together to be empowered and be active and do activism. And the story behind the West Oakland Environmental Indicators Project is just a really powerful and compelling one. And I'd love if you could share sort of some of the origin story. When did you first notice that kids in West Oakland had health problems, and what did you do about it?
At one time, I had a job with the local health center that was doing violence prevention program, and we had correlated violence within the city of within the neighborhood based on the drug epidemic that we had, the drug issues that was going on, and people being addicted, that was giving the children a lot of problems. So we as the West Oakland Health Council violence prevention program was able to get funding to do an after-school program where we took first and second graders and matched them up with a youth from McClymonds High School. But the primary school was called Prescott. So we would match a child up with a teenager and do homework with them after school and talk about how to stay out of trouble. And just had conversations about what violence do to the community, what violence do to the family, and what violence do to themselves. So as I would go visit the school, Prescott School, I would go to the nurse's office and ask about some kid who maybe been absent for class, and that she probably had got a call or something like that. So when I would go into the nurse's office, she would have baskets and shoeboxes full of inhalers. That was the first thing that really sparked my attention. And then right after that, we got several more grants. We got other grants that started looking at the issues of health and public health in West Oakland. And I joined those committees, and eventually we got a small grant with the Pacific Institute, which is a research group who had got a small grant to show West Oakland residents how to use research and data. And that was back in about 1994, 96. And then from then on, at the same time, as we learned how to measure stuff because of an indicator, we got more involved in asking questions. Why is this in West Oakland? Why is this on my block? Where is this smell coming from? And as we did that, we started developing relationships with researchers, data collectors, some engineers, and we were able to, and some grad students and PhD students from UC Berkeley from the regional, from the urban and regional program that was also interested in environmental and social justice and environmental justice. So they were able to give us lots of insight and how to, lots of insight that we had never had about these issues that turned the conversation from being very academic to very colloquial, that are putting into popular education so people can understand the language of the engineers, of the scientists, of the researchers, and that became a tool, a new tool for us to have. It's called popular education. And with popular education, we were able to develop a method of advocacy in various campaigns to be able to have the conversation with community where they were at. And I was one of those residents, and I just stayed with it. And there's other residents who have stayed with it, but also gave us the ability to talk about our impacts on the same par, on the same level with the polluter and the agencies, which they had never had before. So having the research and data put you in a different place of really explaining what's happening in the community and how it personally affects you. So we started looking at how many trucks came through the neighborhood. Why did we have this smell? Why our window sills are all black? Why was our so many children had asthma? People having cancer or COPD. We start asking those questions. Why was so much trash placed in West Oakland? Why did we have so many break-ins? All these different things. So we were able to advocate from the research on these different items, either through the state, through the feds, through the county, or through at City Hall.
That's amazing.
So that's our story about how West Oakland Environmental Indicators became an organization.
Thank you. And you did your own research too, right? In sort of pioneering the citizen science data collection and having that be...
As an organization, not as an individual, as an organization.
Sure. Maybe you could just tell us a little bit about that and why it was so important for people to collect their own data.
Well, one of the first things that when we start talking about air quality, we had to understand about air monitors. We didn't know. I really didn't know from the beginning that the Air District or the California Air Resources Board or U.S. Environmental, U.S. EPA had anything monitor equipment in the community. So we learned from other researchers that there was a difference in the range of air quality from being 2 or 3 stories up compared to where people were on the ground, coming out your door, getting out your car, walking down the street. There was a different level of air quality. And so we started asking the questions, and as we started asking the questions, all of a sudden there seemed to be some devices were started being developed. A backpack with an air monitor being developed, and we were able to acquire those backpacks with air monitors in, which was an air monitor to detect 2.5 or 10. And that was with Intel when they was doing a prototype project in Berkeley, and they actually wanted to do was to develop an app to put in your telephone that you hold your phone up in the air and you could tell you what was in the air, what was the air quality for that particular time. So we were able to take at least 25 residents through a training around how to use those air monitors. And from that, and also being able to download it on a draft gave us, and having a scientist, researcher, or technical person interpret what was going on from those printouts. That gave us the beginning of understand community, not only just community citizen science, but also community-based research and data collection.
Mm-hmm. Yeah, and I love this.
So that's how, and then we also had to organize a table to bring all the agencies to one table, and not have to go to see this one, go over here to see Barry Air Quality, over here to see CARP. We developed a method of putting everybody at one table, and even the port. So, and especially as there was a transition of some kind from the state saying that the port had to do a reduction of emissions, and they had to have community engagement, community involvement. So that also gave us a place to enter to bring our own information.
And you achieved some really tangible results from that. Could you maybe share us like some of what those were? I mean, West Oakland is a different place because of the West Oakland environment.
Well, we were able to achieve a truck route where trucks could come in and off the freeway and in and about the neighborhood. We also were able to get a truck parking facility out of the neighborhood. We was able to collect that data, support the new idling rule that trucks can run their engines, and that they had to have updated engines that didn't require for keep running the engine. We also was able to get upgraded trucks through policy, through CARB, that in order to be a truck driver, you had to have a tier 3 or tier 4 truck, or a truck with a filter on it. We also was able to get the Port of Oakland to electrify their docks. So when the ships came in, they were not idling their engines anymore. So those are some of the victories we have had.
It's amazing and just humbling and inspiring what your work has accomplished. And Phoenix, I'd love for you to tell us a little bit about AB 617 and some of the current work that y'all are doing. I mean, this idea of citizen science as a tool for political agency is, I think, really, really compelling. And also, I mean, it sucks that it has to sort of come from the community in a certain sense, right? And that, as you said, Ms. Margaret, the observations of anyone who lives in West Oakland, going out, running your finger on your car, your house, your windowsill, you see the stuff that you're breathing in, and that it needs to, that communication wasn't trusted, and that sort of data had to be collected to really affirm that is its own issue for us to sort of discuss. But I'd love to hear how this movement is growing and what you're working on now.
Yeah, well, we believe that people need to be a part of the political process in order for it to be done effectively. So when you talk about AB 617, what it is Assembly Bill 617, and it allows for communities to create their own community action plan around air quality to help improve air quality in their communities. So West Oakland Environmental Indicators was the first. We have our community air action plan right here, Owning Our Air, to get this done. And the reason why we're able to do that is because of the great work that Ms. Margaret and Brian Beveridge have been doing over the years. We already had the data in place to drive the decisions about where we needed to target and find places to improve air quality. So there are 84 strategies in this Owning Our Own Air. And the way that it's going forward now is that there is a steering committee, and there are various subcommittees that are meeting on a regular basis and going through the 84 strategies and figuring out which ones they want to focus in on which ones they want to follow and which ones they want to pay attention to. So that's happening right now. As Ms. Margaret has led, we have on each of the steering committees, we have co-leads who are our community members that we have trained to be a part of the process and equal power to the folks who are working in the agencies. And so it's really a community-driven process. And as part of AB 617, we also go to other communities and talk to them about how they can set up their own air quality monitoring plan.
Thank you, Phoenix. This is really wonderful that this work is expanding to multiple communities. And we only have a few minutes left, but I want to recognize that, the reason that we're not all sitting in one room together is because we're in the middle of a global pandemic that is intimately connected to race and air quality. And Dr. Munoz, I was wondering if you could tell us a little bit about some of the correlations between COVID-19 and air quality and race and where we live.
So, early on in the pandemic, we began to recognize that the Black population was disproportionately being affected by COVID-19. They had an increased number of deaths and increased number of hospitalizations. And the thought was, people who have underlying chronic conditions tend to do worse. And we've talked about many of the reasons why people of color have a higher burden of disease, right? But more recently, we've have had data come out that suggests that chronic exposure to particulate matter from air pollution also increases your risk of death from COVID-19. And in fact, just a small increase can have a significant impact on whether or not you're going to survive the infection. Yeah. And so I was just going to say, some of the thought is, just chronic inflammation. And again, just the chronic disease, that the burden from this chronic exposure to air pollution that people of color have had.
So, Ms. Margaret and Phoenix, you've talked about how important it is for the community to be involved, to be at the table, be a driver, be a leader at the table. And especially as we talk about, these really difficult issues, all three of you are involved in environmental justice organizations, which is wonderful. And I'm wondering, what can people do for our audience who are watching this right now? What can people do to get involved and to help out?
Well, if you want to be a part of AB 617, you can actually participate in our steering committee or our subcommittee meetings. So in order to do that, you can just email our campaign coordinator, Jameer Howard, at jhoward.weip@gmail.com. Connect with him, and you can join in our meetings. They're on Zoom as well, so you can just jump on a Zoom call and give your comments. And then one strategy that I want to highlight that's coming forward is the city of Oakland is putting forth its urban forestry mastery plan, and this is going to be an accounting of all of the trees in Oakland and all the places where there are not trees. So one of the problems with environmental justice burdens is that the communities that are in the hills that are rich and affluent tend to have a heavy tree cover versus the communities in the flatlands that are mostly Black and brown people have very little tree cover. We want to change that. We can't change it without the community involved. So we're going to need folks to be identifying places, planting trees, looking for places where they can, where we can grow more greenery in our communities.
One of the things that we would be much appreciated if people would just follow our Facebook, our donate money, hopefully ask for orientation and education about the work that we do. Those are some of the things that really facilitate the process of people being engaged, because the more you know, the more you learn, the more you know. And right now, because of the virus, people are not that engaged to the level that besides just being on the street. But after you do all the good work of being on the street with demonstrations and you still, at the end of the day, somebody has to go back inside the room and develop policy, making collaborations, coalitions, facilitating the process to keep the ball, eye on the ball and eye on the prize at the end of the day. And based on this time, place, and conditions, and we should not just leave it up to the youth. It's everybody's responsibility to try to get as much information and clarification about what's in their surroundings.
Yeah, and I'll just say, environmental degradation and climate change really is a health crisis, and it will affect every single one of us. We are being affected now. And so I would like to urge everyone to stay informed. Like Ms. Margaret said, knowledge is power. The more you know, the more powerful you are. And please go out and vote. We need leaders who can truly represent us and who have our best interest at heart. And we don't have that right now.
Thank you so much, the three of you, for joining us today. We've really, really appreciated this conversation, and really urge folks to take a look at the links and some of the actionable things that our panelists just mentioned. In the middle of these two global pandemics, it is so important that we are examining structural racism within our own institutions, within our own communities, and doing what we can to respond. So thank you, everyone, for watching as well. Hope that this is going to be, one of many conversations that we're having at the museum about environmental racism, and we really appreciate you joining us this evening. Have a good
Thank
day.
you.
Thank you.
Aloha mai kako. My name is Daniel Lynn. I'm coming to you from the island of Oahu in Hawaii. Thank you to the Exploratorium for this opportunity to share a film that I created. So my background and my history stems from work in photojournalism, and especially around Pacific Island histories, cultures, and environmental issues. That led me to create what is now called the Pacific Storytellers Cooperative, a collection of stories from and by Indigenous Pacific Islanders across the region, with a nonprofit support called PREL. And since then, I've currently work in film production and supporting and producing at a foundation called the Niatero Foundation, based in Seattle, and where we support and stand and uphold Indigenous guardianship around the world. I particularly work in the Pacific. So my journey into filmmaking started with this film that you're about to see, called Anointed. It started with a conversation between me and a dear friend and poet, Kathy Jetmill Kitchener, who is in this film. And our conversation centered around wanting to shed light on an issue of nuclear legacy and maybe nuclear shame that several Pacific Island communities have, and just aren't really told in the voices of the communities themselves. And being a photojournalist, I just knew that this was too big and the magnitude of this story needed to be told in a way that was more visually capturing and more visually in your face. And so we decided to embark on this journey of filmmaking, one I had never done before. So this was my first film. It's still a very special and pertinent film to this day, and I really hope you enjoy it. And I think you'll understand why it needed to be told in film form, hopefully after you see it. Thank you, and aloha.
I'm coming to meet you. I'm coming to see you. What stories will I find? Will I find an island or a tomb? To get to this tomb, take a canoe. Take a canoe through miles of scattered sun. Swallow endless, swirling sea. Gulp down radioactive lagoon. Do not bring flowers or speeches. There will be no white stones to scatter along this grave. There will be no songs to sing. How shall we remember you? You were a whole island once. You were breadfruit trees, heavy with green globes of fruit, whispering promises of massive canoes. Crabs dusted with white sand scuttled through pandanus roots. Beneath looming coconut trees, beds of watermelons slept still, swollen with juice. And you were protected by powerful Iroj, chiefs birthed from women who could swim pregnant for miles beneath a full moon. Then you became testing ground. 9 nuclear weapons consumed you, one by one, engulfed in an inferno of blazing heat. You became crater, an empty belly. Plutonium ground into a concrete slurry filled your hollow caverns. You became tomb. You became concrete shell. You became solidified history. Immovable, unforgettable. You were a whole island once. Who remembers you beyond your death? Who would have us forget that you were once green globes of fruit, pandanus roots, and whispers of canoes? Who knows the stories of the life you led before? Here is a story of a turtle goddess. She gifted one of her sons, Ledao, a piece of her shell anointed with power. A leathery green fragment, hollow as a piece of bark. It gave Ledao the power to transform into anything, into houses and trees, the shapes of other men, even kindling for the first fire. He almost burned us alive. I am looking for more stories. I look and I look. There must be more to this than incinerated trees, a cracked dome, a rising sea, a leaking nuclear waste with no fence. There must be more to this than a concrete shell that houses death. Here's the story of another shell, anointed with power. Ledao used it to transform into kindling for the first fire. He gave this fire to a small boy. The boy almost burned his entire village to the ground. Licks of fire leapt from skin and bones, from strands of coconut leaves. While the boy cried, Ledao laughed and laughed. This is a story of a people on fire. We pretend it is not burning all of us. Here is the story of the ways we've been tricked, the lies we've been fed. It's not poisonous anymore. Your illnesses are normal. You're fine. You're fine. My belly is a crater empty of stories and answers. Only questions. Hard as concrete. Who gave them this power? Who anointed them with the power to burn?